Hi, I'm Dr. Chris Gubbels from Square One Health, and today I want to discuss with you the biggest risk factors for developing knee pain. Now, knee pain or chronic knee pain is a big pandemic in the United States. 1 in 4 adults worldwide suffers with chronic knee pain. So we're going to divide these into both personal risk factors and joint-specific risk factors. Some of the biggest personal risk factors include 1, genetics. 30 to 65% of knee pain can be attributed to genetics, meaning if you have people in your family that have chronic knee pain, you have an increased risk of also developing chronic knee pain. Another one of those is obesity. If you are obese or if you're overweight, that puts increased loads and stress on your joints, and that increases your risk of developing knee pain. Along those lines, we have hyperlipidemia. Hyperlipidemia is when your cholesterol levels are elevated, meaning you have high LDL and low HDL. Elevated or high LDL increase your risk of developing knee pain, and low HDL decreases your risk of having knee pain. High blood pressure also associated with increased risk of developing knee pain. And another one of those is low vitamin D levels. And low vitamin D levels is really important because vitamin D levels helps you absorb calcium, and it's related to healthy bone and mineral density. So those are all what we consider personal level risk factors. Now, the second type of risk factors, the ones that probably has a bigger impact, is we call joint specific risk factors. And there's a few of these that we need to talk about. One of those is muscle mass. Specifically, we talk about cross-sectional areas or the amount of muscle mass around a knee joint. When we dive into that deeper, we know that it's the amount of muscle mass compared to fat tissue ratio. So if you have a low amount of muscle mass and a high percent of body fat around that joint, that increases your risk of developing chronic knee pain. Misalignment, this is probably the biggest one. And there's two big or major conditions we want to talk about when we talk about misalignments to the knee. Both valgus and vargus knee misalignments. That's when your knee is actually angled in or out, like these pictures show us over there, and that puts increased pressure on the inside and outside of your knee, and it causes that knee joint space to break down and decay and leads to arthritis. Along with that, I want to talk about having a short leg. If you have one leg that's shorter than the other, that will cause your body weight to transfer over to that side. You will lean to the side of the short leg, and that puts excessive stress on that joint, and that can lead to chronic knee pain. Repetitive activities. When you think about people that have specific occupations, whether it's a fireman, a construction worker, or maybe just a high-level athlete, people doing repetitive activities where they're putting repetitive microtraumas on those joints over and over, that can lead to knee pain and arthritis. Having a prior injury. If you've had a prior ACL tear or an MCL tear, which is those ligaments in your knee, if you've injured one of those in the past, or you've had a meniscus tear in the past, that increases your risk of having or developing chronic knee pain. Along with that, having a positive MRI finding where you see an injured or damaged or weakened ligament, or if you have any damage or injury to the meniscal tissue itself, that is a high predictor of developing chronic knee pain. So that wraps up our risk factors for developing chronic knee pain. We talked about both personal risk factors and joint-specific risk factors. Now, some of these things are things that you can easily address at home. Taking vitamin D supplementation if you have low vitamin D, proper diet and exercise if you're overweight or you have high cholesterol levels. Those are things that you can address at home. And then some of these things you may need professional help to address specific causes of those things. So if you're dealing with chronic knee pain or you have some of these risk factors, watch some of our subsequent videos or other videos that I have created that deep dives into specific treatments that are non-surgical and non-drug treatments to help deal with knee pain. So Dr. Chris Gubbels here from Square One. Hope you found this video helpful, and look out for other videos where I give more tips and suggesting for dealing with knee pain.